And joining us now to talk about your health is Deirdre Smith, vascular surgery nurse practitioner at the University of Maryland, Baltimore Washington Medical Center. Ms. Smith, thank you very much for joining us. We want to talk about vascular issues. Millions of people have this, may not know about it. Why is it important that they find out?
Sure. So vascular health is very important. And a lot of people don't know that about 6.5 million people really have vascular disease. It's something that can affect your bloodstream and cause you to have a stroke. Some people have aneurysms or lose blood flow to their legs, which ultimately can lead to increased morbidity and mortality. So education about vascular health and peripheral arterial disease is of utmost importance.
Are there warning signs that people might experience, or are some of these, silent conditions as they develop?
Sure. So there are definitely warning signs that people should consider. When talking about peripheral arterial disease, there's three, I would say, main areas. The first are the carotid arteries, kind of up here in the neck. You have one on either side of the neck, and those supply blood flow up to the head and the brain. And if you lose blood flow, there you can cause a stroke or a mini stroke. And so sometimes those narrowings can occur without patients having symptoms until a big event like a stroke happens. So knowing the risk factors and the warning signs can actually prevent that from happening if we are able to intervene surgically prior to. Also, with aneurysms in the abdomen, sometimes until they rupture, you may not know that you've got an aneurysm that is enlarging over time until ultimately it's too late and it becomes an emergency. I would say for the majority of patients that have peripheral arterial disease in the legs, that lose blood flow to the legs, we do find that they would present more sooner with symptoms. So they would have claudication or cramping in the hips, thighs, or calves, especially when they exert themselves or during activity, or have a wound that won't heal over time due to the lack of blood flow in that area. So I would say for the lower extremities, they probably have warning signs a little bit sooner, but for the aneurysms and the carotid arteries, probably not so much.
You happen to have a model of an aorta sitting behind
I
you.
do.
And I was more familiar with the things where you might have a clog someplace. This is a different and very scary condition.
Yeah, so this is a scary condition. And most often, patients will describe having either terrible abdominal or back pain that's unrelenting and won't go away. Or sometimes on physical examination, we find a pulsatile mass in the abdomen, which kind of warrants further imaging and further studies. But, controlling this is probably of utmost importance, especially when you're talking about your risk of rupture, which definitely increases as this abdominal aortic sac becomes larger and larger.
People may think of vascular issues in the context of heart disease, where you have a artery that gets clogged, and that can burst, can clog it, but stents are available. So how much does that apply to other areas of the body?
So I would say that the pathophysiology or the mechanism is exactly the same as in coronary artery disease or heart disease. So there are fatty deposits that are circulating in the bloodstream that begin to build up over time and cause a narrowing. And when that narrowing becomes severe, that's when signs and symptoms begin to exhibit that indicate some type of vascular disease. And similarly, to heart disease, you're right, angioplasties, balloons, or stenting can be done to increase blood flow to those areas to prevent further damage.
You're running some screening events. Who should come in to be screened for this? And it's not painful, right? There's no needles involved.
Correct. This is totally painless, and you should not be afraid of coming to get a screening. It is a simple ultrasound that's done here at the University of Maryland at Baltimore Washington Medical Center. We want to provide quality care to our community. And so offering the service is really important. Knowing your family history and your personal history is very important. Some people don't know whether or not their family members, first generation, either their parents or siblings have had strokes, and that definitely increases their risk for stroke, or whether they've had heart disease or other vascular diseases. That's important to know as well. And once an appointment is made for a screening, it's a simple ultrasound that's done. It's about 20 minutes long for the screening, which includes the brief history that we'll gather, as well as the ultrasound studies. And then afterwards, you'll be able to review your results with a provider who would be able to comment and tell you whether or not you need to come back for another appointment, or whether, you may just need routine follow-up every 1 year or 5 years, depending on what it is that we find on the screening.
But what would you say, based on your clinical experience, say to somebody who is reluctant to be screened for this, thinking that, obviously nothing good is going to be found, and if there's a problem, it's going to be a serious problem. How would you address that concern and explain the upside to getting screened?
Sure. So I think education and knowing is probably the first step in any type of vascular situation, is knowing what's going on, knowing the risk that it could potentially cause, and correcting that before it becomes an emergency. There is a slight bit of anxiety, which is totally understandable, around getting health checkups and making sure that your blood pressure is managed well, and that making sure your cholesterol numbers aren't too high. And also, like we're talking about, getting these screenings, of course, if you have a strong family history or eligible for one. But knowing is the best way to kind of set you on the right path, so that what you have can be managed, and that if intervention is needed, that's done sooner rather than later.
Deirdre Smith of the University of Maryland, Baltimore Washington Medical Center. Ms. Smith, thank you very much.
Thank you so much for having me, Jeff.